And when we come back, we talk all of the time about the world-class care that is available at AtlantiCare. And, of course, that comes down to everything that they have by way of their facilities and their technology and their equipment, but it comes down to the quality of the people, the doctors. We have a world-class doctor that's, I think, about 20 feet from me right now, Joseph Lombardi, Chief Physician Executive, Chairman of the Heart and Vascular Institute, a very talented vascular surgeon at AtlantiCare. And we're going to meet and greet, have an on-air meet and greet with Dr. Lombardi this upcoming hour right here on the Hurley in the Morning program. Stay with us. Don't go away. We'll be right back.
From Harry Hurley Way in the world's playground to the broadcast pioneers of Philadelphia Hall of Fame, you're about to find out why Harry Hurley has been named to the Talkers Magazine list of the 100 most important talk show hosts in the nation. Live from the studios of Town Square Media in Northfield, it's Hurley in the Morning on WPG Talk Radio 95.5 and the WPG Talk Radio app.
Thank you very much. Welcome back. It is 4 minutes past the hour. It is my pleasure. I have spoken about him behind his back several times over the past couple of hours, and it's my pleasure now to officially introduce Dr. Joseph Lombardi, who is the Chief Physician Executive, Chairman of the Heart and Vascular Institute, a talented vascular surgeon in his own right at AtlantiCare. Just to tell you a little bit about Dr. Lombardi, and we're going to learn more about him. When I talk about the world-class care that is available at AtlantiCare, I mean, it's basically I'm talking about people like Dr. Joseph Lombardi, who is absolutely world-class, internationally recognized vascular surgeon, specializing in aortic aneurysms, stroke prevention, peripheral vascular disease, a pioneer in minimally invasive aortic surgery and carotid disease research, and he has authored over 120 peer-reviewed publications and is a sought-after speaker worldwide. As Chief Physician Executive at AtlantiCare, Dr. Lombardi brings his expertise in clinical care, education, and healthcare leadership to advance patient outcomes and innovation. He is board certified in vascular surgery, holds an MBA, and is pursuing a master's in corporate innovation. Dr. Lombardi's dedication to precision and care shines through in every procedure, making him the trusted choice for those seeking these exceptional surgical expertise and talents. And I mentioned earlier in the program, I love the quote that I read from Dr. Lombardi, quote, "I love the immediate impact of surgical care. The patient enters the operating room with a potentially devastating problem, and when they leave, the problem is fixed thanks to the work of our dedicated team of experts." Dr. Lombardi, welcome to our program.
Thank you, Harry. Pleasure to be here.
It is an honor to present you, sir, and I want to thank you, and I want to thank your whole team again. I did do it on air a ton of times. I wrote an extensive article about it on our digital platform. AtlantiCare literally saved my older brother's life.
Yeah.
He there's no question about it. He was going to die, and it's not. He allowed me to make it public. So and he's a pretty private guy, but I was able to share with the public that he had 99+% blockages, and he was in bad shape.
Yeah. So thanks for sharing that with me. You know, I'm sure your brother will attest that it really takes a coordinated team of experts to get something like that done.
He did, and he does. And what was so amazing about it is the recovery was unbelievable, and he is doing fabulous.
Great to hear that.
And as you know, and I'm not going to pick a year, but it wasn't ancient history. It wasn't that long ago where if you got news like that, you were pointing your car or an airplane 60 miles away, 120 miles away, or Cleveland Clinic or even further. You weren't staying. It wasn't a home game for something like that.
Yeah, no, that's
all different now.
It's all changed. It's all changed. All the care you need is right here. And, that's part of the reason why I'm here. It's been a tremendous journey over the last several years of getting to know people in AtlantiCare, and this is where I want to regrow my career.
Our guest this hour is Dr. Joseph Lombardi. He is the Chief Physician Executive, the Chairman of the Heart and Vascular Institute that we talk about a lot on the Hurley in the Morning program, and a very talented, well-regarded, well-respected vascular surgeon. And this is our on-air official meet and greet with Dr. Lombardi. So let's do that. I shared a little bit about your background, but tell us a little bit about yourself.
Oh, sure. Thank you. How far back do you want me to go?
Time is yours.
Well, I was born and raised in Philadelphia. And actually, I was born in the hospital that I ultimately did my residency in.
That's pretty awesome, isn't it?
Yeah, so I got to see where I was born.
I was born in your hospital.
Is that right?
Yes. Here in Atlantic City.
So, so that was all very interesting. And throughout my education and residency training was all done in Philadelphia. And my first job was at Jefferson, where we were able to build an aortic program and an educational program. And then I was wooed over to Cooper 16 years ago to develop a program there. And so through all that, I've gotten to learn a little bit about the delivery of healthcare and how it impacts large quantities of people, and how I want to use my career in impacting that in a way that was available to me through AtlantiCare.
Dr. Lombardi, I'm going to share something very briefly about me to you. I am a nurse dad.
Awesome.
So I'm very proud of that.
Me too.
And what's so cool about it is, and I'm going to turn this into a question for you, there are people at a very young age that know what they want to do in life. So my wife Margie and I, we have 2 daughters and a son. Our middle daughter knew at a very young age, after she had an experience in the Atlantic City Medical Center City Division with a surgery that had to be done, that she wanted to be a nurse. She said she wanted to be a nurse. Her grandmother was a nurse for more than 50 years. Her aunt has been a nurse for 30 years. So, and cousins that are nurses. So it sort of comes with the lineage. She knew she wanted to be a nurse. Why did you want, and when did you know that you wanted to become a doctor?
Well, that happened in high school. And, my proficiency in the courses that we took in high school was always very elevated in the sciences. And, one day my uncle said to me, he goes, "Hey, you know what? You're killing it in science and chemistry." And he goes, "Why don't you become a doctor?" He goes, Why are you thinking about anything else? And I really had no intention of going to college. My dad is a butcher, and I was working in his shop after school every day and cutting meat. And so I said, you know what? After working in that store for a couple of years, my ambition to go to college was never greater. And then I started taking courses in college that got me to this point. Ultimately, though, it was in high school where I got the ambition.
You at a very young age.
Yeah, absolutely.
It is amazing. I would call that a moment of truth in your life at a very young age where you weren't even thinking about that, and then suddenly that became your focus.
It is. It's very true.
And you didn't think you were even going to go to college, so you went to college, and then you went to medical school, and so you went to a lot of school after thinking you weren't going to go to school. One of the things I've always believed is that everything that's important, there needs to be an operating philosophy behind it. What is your care philosophy?
Oh, it's very simple. What would I do if it was my mother and father in front of me?
I love that.
And it keeps me always picking the right course of action.
Funny story is a very dear friend of mine that does our show every month, that's both a friend and a client, and the philosophy of his business, which is 46 years old now, is that you treat every client like the owner's mother.
Yeah.
And you can't miss.
Yeah.
You can't lose.
That's the truth.
When you do that.
Yeah, it's guided me, and thankfully we've made some really good decisions with that philosophy. Yeah.
I mentioned early in my introduction, Dr. Lombardi, about the world-class care that's available in interviews that we've done with your president, Michael Charlton, and many other folks from AtlantiCare. It's extraordinary to get to learn all of the world-class care and facilities that are available right here, whether it's at the mainland campus or the Atlantic City campus. Tell us your thoughts, and obviously the position that you hold is a very important, high-ranking position as a surgeon, chair of the Heart Institute, and all of that. I'm sure that was attractive to you.
It was, and I've always admired AtlantiCare from a distance. I wasn't too far off. We've often discussed programs that we could have collaborated in, and along that journey, I got to recognize there are some real quality physicians and nurses and staff here, and the programs that they have developed are all real key programs. The heart program is outstanding, one of the top programs in the state, if not the top program in terms of cardiac catheterization, now we have the opportunity to springboard off of this and develop other programs like aortic surgery, like limb salvage surgery, with the addition of a new vascular program. So there's a lot of infrastructure that's solid that we can really develop and build around. But what you had just mentioned, what we have here now, is outstanding.
I think I have said this on air before, but if I haven't, it'll be a first. It could be a first. I don't remember if I said this, but because of my brother and how serious his condition was, I went through a whole battery of tests and things at AtlantiCare, and I went all the way through to the heart catheterization. Mm-hmm. So I can speak to this now.
Gotcha.
Something I never thought I would ever have, done. And when you are awake and you have a wire that's in your heart, and through the veins, and it was amazing, actually. Yeah. To go through that.
And it's a lot of fun doing that procedure, too, I got to be honest.
and I will tell you, it was really a lot of fun when the doctor told me that I was an accidental tourist and that I didn't have what my brother had had.
Gotcha.
It was a very good day. It was a good feeling. But that's something that people would go somewhere else to do, but it's right here now at AtlantiCare.
Of course.
I did it with confidence. I had no apprehension. I knew I was with as talented a team as you will find anywhere.
Thanks for that. No, it's very true, and I'm glad you had a good experience.
Really did.
Yeah.
We're going to take our first break. We're going to come right back. Our distinguished guest, is Dr. Joseph Lombardi, and I knew you were going to be awesome, and you are. Chief Physician Executive, Chairman of the Heart and Vascular Institute at AtlantiCare, a talented vascular surgeon. Much more content straight ahead. Stay with us with Dr. Lombardi. This is the Hurley in the Morning program.
You're listening to Hurley in the Morning.
We live in a society where everybody is offended.
WPG Talk Radio 95.5, South Jersey's talk station. Hurley in the Morning, WPG Talk Radio 95.5. You're listening to Hurley in the Morning.
Mays Landing.
I'm from Mullica Township.
Listen at home or in the office on your smart speaker. Just say, play WPG.
EHD.
Ocean City.
Hurley in the Morning on South Jersey's talk station. WPG Talk Radio 95.5.
Thank you so very much. We are back at 21 minutes past the hour, and our distinguished guest on AtlantiCare Presents is Dr. Joseph Lombardi, the Chief Physician Executive. I want to ask you, tell people what that means. As Chief Physician Executive, does that mean what I think it means?
Yeah, so, it's a position that's not too widespread these days, but it's developing a lot of popularity in health systems because it really does provide a leadership figure for the physician group in terms of program growth, development, in addition to recruitment. Yeah. It's a strategic position that I really am fond of. In addition, the collaboration that goes on between the physician executive and all the hospital executives in terms of operations and quality and whatnot, it's very fulfilling, and you're really involved in every aspect of the hospital and physician group.
And if I'm reading this correctly, and I think I am, what I love about it a whole lot is you are still a vascular surgeon, too.
That is correct.
So, sometimes you have an administrator, the administrator, doesn't know what we're going through. Well, yeah, you do.
Yeah.
You are a vascular surgeon on top of being the chief physician executive, on top of being the chair of the Heart and Vascular Institute. Let's get into the topic now that we've done a meet and greet with Dr. Lombardi. What is atherosclerosis?
Oh, there's a good one.
Yeah, we're getting right into it.
Yeah, well, so this is the basis of most heart and vascular issues. So atherosclerosis is something that develops in your arteries as a result of a mixture of diet, lifestyle, genetics, And ultimately what happens is plaque formation occurs within the arteries, causing blockages or stenosis or the ability of a plaque to rupture over time. So a lot of things can influence this, but what you hear today is the word or statement risk factor modification. And all of this is really centered around how do we optimize someone's life based on these risk factors.
And what does the vascular surgeon do relative to this?
Yeah, so you could think of vascular surgeons as human plumbers. So we take care of all blockages, diseases of all the arteries in the body, with the exception of the heart and the brain, because neurosurgeons take care of the brain and cardiac surgeons take care of the heart. But everything else is fair game for a vascular surgeon in terms of repairing arteries, bypassing diseased vessels, in addition to treating ruptured aneurysms and carotid disease.
I'm a layperson, as you know. We used to hear all the time about placing stents. Is that happening less? Is the actual artery replacement happening more than placing stents? How is that all going?
Yeah, so you're describing a more minimally invasive way of correcting a blockage. And stents are actually very effective, as we know, in the heart and treating coronary disease. But they also become very effective in the periphery, meaning in the legs for limb salvage and in other areas that are very important for ongoing blood flow. So stents are here to stay. There's new drug elution that coats the stents that allows the stents to last longer. So this is something that's here to stay and will continue to develop technologically.
We are visiting with Dr. Joseph Lombardi on AtlantiCare Presents. What are some of the most common vascular disease issues that present to your practice? So for a vascular surgeon, one of the most common complaints is, hey, my legs hurt when I walk. And they hurt only when I walk. When I rest, pain goes away. When I walk, I get a tightening of my calves and my thighs. So that's an indicator that there's some blockage that's not feeding enough blood flow to that muscle group. And that's why they get tight. Just like chest pain, where there's not enough blood flow to the heart and you're having a heart attack, you get a tightness in your chest. Yeah. Here you're getting a tightness in your legs. And you're not having a leg attack, but you are having ischemic symptoms that suggest that you probably have pretty significant peripheral vascular disease. Bonus question. A listener who, because I have been promoting for several days that you would be joining us today, and this individual said they've noticed, they're 65, they noticed that they have some, like, I don't know if you want to call them broken blood vessels or something like that. They described it, that's down by their ankles. Mm-hmm. And they also said when they wear their regular type socks that there's like a compression mark that's left. And of course, because the internet can be both helpful and scary and inaccurate, they start to think they have something to worry about because, if you get this indentation and stuff like that. So the bluish busted veins or whatever they are and this type of indentation, is that a concern, or is that, hey, it's elastic, so it's going to make a mark, and then when you take the sock off, it's going to pop back out? It's like your wedding ring.
Yeah, you beat me to it because that's the second most common presentation, and this is an indicator of venous insufficiency. So what that means is that you have valves in your veins that are one-way valves, and over time these valves become incompetent. And instead of a one-way street, it becomes a two-way street. So every time your heart relaxes, this pressure builds because these valves are not containing the blood flow above at every stage and every level of your body. So what happens invariably is you have a little bit of swelling in your leg that accumulates over time. And I bet your friend will say, my legs look fine in the morning.
Yeah.
It's only at the end of the day when I take these socks off, I see this ridge. And that is not necessarily an abnormality, but more of an indicator that these valves are not working so well. Now, having said that, if you have leg swelling and you're short of breath, well, you've opened up a whole new world. So that could be an indicator of heart disease, congestive heart failure, and that sort of thing. So it's the astute primary care doc who can look at this, get a good history and physical, and put you in the right direction.
With Dr. Lombardi today and all the long-form interviews that we do monthly with AtlantiCare, when you want to find out more information or to make an appointment, go to AtlantiCare.org. Very, very simple. It's a great website, very well done, very easy to navigate. Scheduling appointments is self-evident. You'll see the hyperlinks, AtlantiCare.org. If you stand for an extended period of time, people also sometimes say as they get older that they'll get that fluid buildup. But then they relieve the sit down or whatever or relax, and then the swelling goes down. Is that evidence of a potential problem, or is that a normal symptom of aging?
It really depends on the symptoms of your presentation. If you tell me you can walk 10 blocks without being short of breath, then that isn't a problem. However, if you have difficulty getting from A to B and it's a short distance, in addition to that, well, then that requires a little more investigating.
Because you figure, the casino experiment now, it's 40-some years old, so you have dealers that may have been in their 20s when they started. They're in their 60s now. Yeah. They're standing for 45 minutes or an hour, and then they get 15 minutes and then an hour. And so they're standing for a lot of the day, and they can have this present.
That's absolutely correct.
You definitely hear that from time to time. Dr. Lombardi, what are some aortic conditions and treatments that are offered by AtlantiCare?
Oh, great question. So aortic disease comes in many different flavors. So you could have an aortic aneurysm where there is a bubble, so to speak, or a weakness in the wall that ultimately puts you at risk for rupture. And this is diagnosed usually by CAT scan or ultrasound. But these are most of the time we can fix these, or 80 to 90% of the time fix them minimally invasive, where you go home the next day. So that's one way or one disease treatment. Another is aortic dissection, where there's a tear in the lining of your aorta. That can be life-threatening. It's very painful and something that drives you into the hospital because you don't know what's going on. So when you recognize that, you have to be treated pretty quickly.
Going to do a follow-up right after the break on this, and then we're going to move on to some additional important information. The topic this hour on AtlantiCare Presents Dr. Joseph Lombardi is vascular disease and the AtlantiCare Heart and Vascular Institute. Much more important content straight ahead, and I want to take full advantage of your incredible pedigree because you are a pioneer in minimally invasive aortic surgery, and I saw in your CV about aneurysms and the aorta. I mean, it sounds like scary stuff. I want to talk a little bit about that when we come back in just a few minutes. Don't go away. With Dr. Lombardi, it is the Hurley in the Morning program.
This is the Town Square, New Jersey Info and Weather Network.
Thank you. With Dr. Joseph Lombardi, it is Harry Hurley. I have 3 stories that you can follow on our WPG Talk Radio 95.5 app. You heard him right before Dr. Lombardi, New Jersey Senator Michael Testa, and his desire to eliminate the state energy agency known as the BPU. Former United States House Speaker Newt Gingrich has made an endorsement in New Jersey, and there is a home in Atlantic City. It is known as the Gangster Al Capone House, and it is for rent.
From the Town Square, New Jersey Info and Weather Network, I'm Chief Meteorologist Dan Zarrow. Deep freeze, day 2 of 3. If you're looking for a warm-up, you'll have to wait until Friday, mainly in the teens this morning, high of 30 this afternoon as skies become cloudy. There is a chance for light snow in South Jersey from late this afternoon into this evening, maybe even light accumulations. Otherwise calm and very cold overnight, low 21. Mostly cloudy tomorrow, chance of a snow shower in the afternoon, high of only 29. Get weather 24/7 wherever you are. Download our free mobile app today.
Second Opinions. WPG. Talk Radio 95.5. Hurley in the Morning.
Harry Hurley is the only person on the radio who isn't afraid to speak the truth about what's really happening in Atlantic City.
WPG Talk Radio 95.5.
Thank you so much. Welcome back. 35 minutes past the hour on the Hurley in the Morning program with Dr. Joseph Lombardi. This is AtlantiCare Presents. The topic this hour is vascular disease and the AtlantiCare Heart and Vascular Institute. I want to draw on your incredible talents and your world-class in this in many regards. The aortic surgery, if I remember correctly, John Ritter, he expired because of aortic rupture.
Yeah, his was an aortic dissection.
There you go.
Yeah, and it was very difficult to diagnose, and it can disguise itself as a heart attack. Aortic dissection is also called the great masquerader. Patient comes in with chest pain, back pain. You think they're having a heart attack, and really they're having a catastrophe of a tear in the inner lining of the aorta that's cutting off the blood supply to their coronaries in addition to other vessels.
Would he have done better today than he did back in time when he dealt with his issue?
Yeah,
I think he would have, right?
Yeah, there's the Ritter Foundation, which is sponsored by his widow, Amy Asbeck, who's also a comedic actress. And she's been fantastic at delivering the message of awareness. So when patients come in with chest pain, there's a big mantra called Think Aorta. And it really does give our first line physicians and nurses the idea that, any form of chest pain can be one of these catastrophes, or a pulmonary embolus, coronary artery disease and a heart attack, or an aortic dissection.
Wow. So talk about that. I mean, because it's, as a layperson, it's mind-blowing to me that you are able to do these things that save lives. And when you do achieve the desired result, people go on to live for many, many years.
Yeah, absolutely.
Life-changing.
And to that, and thanks for that, it's also so invigorating when we're seeing new technologies come out that can treat patients more minimally invasive and more effectively for the long term. So when you have an aortic dissection and you get someone out of trouble, guess what? You still have ongoing issues that dissection needs to be dealt with later on. So it's a long-term management and a marathon, if you will, of treating that patient. Wow. So it doesn't stop just with that one treatment.
So amazing. And when you take care of whether it's someone with an aneurysm or some other kind of issue involving the aorta, they can go on to live a normal life expectancy?
Absolutely. Absolutely.
And I know every case could be different, but generally speaking, do they require medication, whether it's blood thinners or any type of medication for a lifetime, or can the surgery simply fix the issue, and away they go?
It's unlikely that they'll require any form of medication afterwards, but depends on how they present and what ongoing issues they have that accompany that aneurysm.
You are listening to the extraordinarily talented Dr. Joseph Lombardi of AtlantiCare. The topic this hour on AtlantiCare Presents Dr. Lombardi is vascular disease and the AtlantiCare Heart and Vascular Institute. What are some of the treatments for carotid disease to prevent stroke?
So a big part of what I do is stroke prevention. So patients have carotid disease that can cause stroke. And a large number of strokes are secondary to carotid disease that is unrecognized. So patients go through these screenings and they're identified with a stenosis or a blockage, if you will, of their carotid arteries that puts them at risk. And when they go beyond a certain level, 70 to 80%, we could either remove the plaque surgically, or we can place a stent, as we were talking before. And the stent technology has gotten very, very good and getting very close to the numbers we achieve with open surgery. Now, it's more minimally invasive. However, durability-wise, we're finding that stents are in the mix when you're talking about what particular therapy you want for that particular patient.
Dr. Lombardi, over the past 34 years, I've had the privilege to conduct interviews with really talented people like you. And what I have always heard from people, many times people suffer in silence. They're afraid to find out what's wrong, which blows my mind. Because I begged a friend of mine once, please, have your colonoscopy. You're 50 years old now. Even if it's not familial in your family, 50, and just do it. Well, he was afraid to do it, and he passed away from colon cancer. He should have been saved. Yeah. He could have been saved. So I want to encourage people to be afraid of not being proactive. Don't be afraid of finding out if there's something wrong. Be afraid if you don't find out. So when we do these long-form interviews, I know, because I've heard from people, they say, oh, my gosh, I felt like you were talking to me. When Dr. Lombardi was talking about this happens and you're out of breath if you do this, and it saves people's lives. What can you say relative to encouraging people to be attuned to their body? We know if something's not right. Occasionally something sneaks up and something can happen, if you have some brain aneurysm or something and you're symptom free and it just bursts, no harm, no foul. You couldn't have known that. But there are people that they know they're out of breath walking up flights of steps. They know that something isn't right. What can you say to encourage them to seek advice and treatment.
Yeah, absolutely. I think it's a fantastic lead-in to why it's so important to be engaging with your family doctor, your primary care doctor, your internist, whoever it is that's providing you your ongoing care. It's the person you're calling for your prescription renewals.
Yes.
So and primary care can come in many different forms, but if you truly have this quarterback who's with you all the time and understands you and gets to know you, you can be open and honest with your symptoms, and then they can direct you in certain areas. But sometimes the fix is so easy and so simple, but ignoring it can be a catastrophe, like high blood pressure. So
the silent killer.
Yeah, it really is. So it's very important that you embrace your primary entry point, which is primary care, and be open and honest.
Talk about high blood pressure for a moment, because they call it the silent killer because it can be going on, and you might not even really know it. If you're not going at least annually to have your well care, visit, you could not know that this is going on because you are functioning as though everything is fine, but it's not fine.
That's correct. And, you don't have symptoms from it generally. You don't have any sequelae from that, and you find out too late. So, again, speaking to that primary care doc, getting your blood pressure corrected, measured, refined is vitally important.
When we come back, Dr. Lombardi is going to talk about treatments that are available for peripheral arterial disease of the legs, including non-invasive treatments and more. That's coming up next on AtlantiCare Presents Dr. Joseph Lombardi. Dr. Lombardi, if you're just joining our program, I'm urging you, when we upload the podcast, please download it, because Dr. Lombardi has shared some very, very critical information during the program that if you're joining now, you've already missed, but you haven't missed it because the podcast will be available for you to catch up. Dr. Lombardi is the Chief Physician Executive, Chairman of the Heart and Vascular Institute, and a very talented vascular surgeon in his own right. We continue on the Hurley in the Morning program right after this.
Starting your day the right way with Hurley in the Morning.
It's a refreshing drive to work in the morning.
WPG Talk Radio 95.5. Apply. Starting your day the right way with Hurley in the Morning. WPG Talk Radio 95.5 and the WPG Talk Radio app. You're waking up with Hurley in the Morning.
I listen every morning.
WPG Talk Radio 95.5.
We're back. It is 10 minutes before the top of the hour. AtlantiCare presents today Dr. Joseph Lombardi. Dr. Lombardi is the Chief Physician Executive for AtlantiCare, the Chairman of the Heart and Vascular Institute, and a talented vascular surgeon at AtlantiCare. The topic this hour is vascular disease and the AtlantiCare Heart and Vascular Institute. Dr. Lombardi, what are some treatments for peripheral arterial disease of the legs, including non-invasive treatments?
Thanks for that question. It's a hot topic these days because we're seeing a lot of patients being treated inadequately or improperly. So patients get pain in their legs, and there are a myriad of different styles of pain and causes of pain in the legs. But they're getting treated for peripheral vascular disease and may not be the reason that they're having leg pain. So I think educating the public in this respect is very important, and not to get more or less drawn down the wrong line for this. But when you do have peripheral artery disease of the legs, you have the symptoms that we described earlier in terms of tightness, but it can also get very severe where the point where you have no blood flow to the toes and you start getting gangrene.
Ooh.
So that's called...
Could you notice at an early stage, or at least an early enough stage, to get the proper care, that your feet might feel cold?
Yeah, generally feet feeling cold is a neurologic type deal. That's not necessarily correlates with peripheral vascular disease.
Glad I asked.
We get a lot of those patients that come out, they have cold feet and they have excellent pulses in their feet. So that's not necessarily a sign. It's the discomfort with walking. That's a problem. Losing hair on the legs, that can also be an initial sign. But if you do have it, it doesn't mean you need treatment. You could have risk factor modification, cholesterol lowering medication, exercise, wonderful for treating peripheral vascular disease and overcoming some of the discomfort you get with walking. So most of our patients have, first and foremost, put on an exercise program. You need to walk through it. You need to quit smoking. You need to eat a little bit healthier. Get on statin drugs that lower your cholesterol. And not only that, but they really do have a benefit in terms of the associated risks of coronary disease and stroke. So it can help you in so many different ways.
Dr. Lombardi, how does the presence of atherosclerosis increase our risk for heart disease? And I've learned in the past from geniuses like you that many times men and women present differently. So speak to both.
Oh, yeah. No, atherosclerosis generally doesn't affect one vascular bed. Usually, if you have disease in the attic, you also have it in the basement, right? So you have a lot of different territories that can be affected by the same process if you're predisposed or had a lifestyle that accented that. So it's really incumbent upon the vascular specialist to screen you and identify these areas to mitigate your risk.
Is there a link between cholesterol and atherosclerosis?
Oh, absolutely. And you've heard of all these cholesterol-lowering medications, and you're like, why should I be on it? A lot of patients get leg pain with cholesterol-lowering medications, and it needs to be monitored because your liver is really the primary driver in metabolizing that medication. But truth be told, cholesterol is one of the leading reasons why you develop atherosclerosis. There are good types of cholesterol like HDL, and there are poor types of cholesterol like LDL. And the proper ratios are very important in terms of minimizing your risk. But the cholesterol will get seeped into your arteries, and your arteries tolerate that differently and metabolize that differently, ultimately leading to fatty streaks and deposits that ultimately go on to form these plaques.
To find out more, because we're covering a lot, Dr. Lombardi is doing a great job covering a lot, but to find more information about AtlantiCare, simple to do, any digital device, your smartphones, laptops, iPads, desktop, computers, so on, AtlantiCare.org. That's simple, AtlantiCare.org. The topic is vascular disease and the AtlantiCare Heart and Vascular Institute. With Dr. Lombardi. Dr. Joseph Lombardi is the Chief Physician Executive, the Chair of the Heart and Vascular Institute of AtlantiCare, and a talented vascular surgeon. What treatments, Dr. Lombardi, are advised and or needed for heart disease?
Well, it really depends on each patient. And I think the Heart Institute has the ability of taking each patient and personalizing that form of therapy. So most patients are put on, blood pressure lowering medications, heart rate lowering medications that help minimize the stress on the heart. In addition to evaluating the valves and seeing what kind of contractility you have in the heart and how strong it is, all these little factors that we're able to diagnose really go into a personalized plan that you can have at AtlantiCare. So it depends on what you come in with, but you could have a valve problem. And so our structural valve team, which is fantastic, can have your valve fixed and home the next day with a minimally invasive treatment. And this was unheard of 10 years ago.
It's amazing.
Right? And so you're also evaluated for ongoing coronary disease. So if you have valvular disease and coronary disease, well, guess what? You're going down a whole different decision tree. So it really does depend on the person and what they're presenting with.
Dr. Lombardi, earlier you did touch briefly, and I'm going to ask you to talk a little bit further about it, about improving the diet. And there's great dietitians at AtlantiCare, but you are here, so let me pose the question to you. What dietary changes can someone listening right now make to reduce atherosclerosis and heart disease risk?
Yeah, great question. I think if you're steadfast in minimizing fat intake, increasing your protein intake, and you're focused more on fruits and vegetables, I mean, this is really the way to go. And that's no surprise to anyone, I'm sure. But it's a difficult these days. It's very difficult to have a diet like that in today's market.
What's your feeling about, for example, beef steak? There are people listening right now, they just love it. And then you hear it's a great source of protein, and then you will hear from people that say, but don't eat too much of it. And I guess like everything in life, you don't want to go excessive, but What's the upside downside?
Well, you're talking to the son of a meat cutter here, so I'm a little bit biased on this one. So
I like that.
Yeah, I think steaks are fine as long as it's in moderation. Anything that's not necessarily good for you, so to speak, is done well in moderation. But if you're taking lean meats like chicken and fish, you can occasionally have that steak you want once a week or whatnot. But I think if you pace it in moderation, then the wide gamut of these types of foods are open to you.
We have about a minute and a half, and let me give you this question to close with. And of course, if there's anything you want to share about the AtlantiCare Heart and Vascular Institute, the time is yours. But give people an idea what a trip through the AtlantiCare Heart and Vascular Institute would and could be like.
Yeah, I in my head, I have it as like the cardiac car wash. You go in one end and you're cleaned and ship-shaped in every different way, and then you come out all nice and clean and shiny. So if you come in, I think it's really important that our docs are going to look over all of your risk factors, and they're really going to tailor some therapy according to those risk factors. And then there's screening and ultrasounds that you can get to look and follow up on these risk factors. But ultimately, you're going to get evaluated in such a way that facilitates perfect management that is unique to you as the individual.
I should have left 2 minutes for this, but we're down to 40 seconds. I want to share quickly my experience with AtlantiCare was so phenomenal. Folks called me before I was coming in to make sure that I was doing the right things before I would come in. Scheduling was amazing. The staff that you meet the day of, all the people that you meet, depending on if you're having a procedure or a surgery, everyone that you are meeting is communicating what you're going to be doing and who you will be with. It was masterclass.
Thank you.
I just want to say thanks.
Thank you very much. It was a pleasure to be here.
Dr. Lombardi, honor to meet you. Thank you for saving lives. And until we meet again.